Hi, I'm Dr. Sarah Bouhabel and I am a pediatric otolaryngologist. In this video, I will show you how to do a tracheostomy change. Before starting any tracheostomy change, you should make sure that you have everything ready. In terms of what you have to prepare, you need a trach tube size, the exact same size as the one that's already in your child. You also need to have a tracheostomy tube that is one size smaller than the trach size that your child has. Just in case you have difficulty inserting this tracheostomy tube, you will have a backup size. You also need to prepare the trach tube by inserting an obturator into the tracheostomy tube, but it also has to be prepared by inserting the new trach ties onto the tracheostomy tube and making sure that they are cut to the appropriate size of the neck of your child. You have to have your suction machine ready, and you also have to suction your child before you do the tracheostomy change. The other thing that you have to have around is a cell phone or a phone ready to go very next to you in case you have an emergency. You also need to prepare a cloth to act as a shoulder roll when you need it. And for the purpose of this video, I am going to change the tracheostomy tube alone, but ideally it would be better to have a second person do it with you, and I will show you what the second person can do to help while I do it. So before we start, basically you have to have your child swaddled so that they don't move. Once you do that, you need a good exposure to the neck of your child. And so to do so, you take your cloth and you roll it. And you make what we call a shoulder roll out of it. And you insert the shoulder roll right under the shoulders of your child. So you lift your child up and you put the shoulder roll right under. And that way it will extend the neck of your child, so you will be able to see the tracheostomy tube as well as the tracheostomy hole once the trach is out. So once you do that, you have the neck exposed and you have everything ready, you are able to proceed to the tracheostomy change. So the first thing you'll do is with your non-dominant hand, you will place and hold the trach tube. And with your dominant hand, you're able to detach the trach ties. And once again, I have had suctioned the child before doing all this. And so once everything is ready, I'm going to use my dominant hand to lift the chin of the child and to remove the tracheostomy tube. Once the tube is out, I will be able to see the hole, and that is totally normal. Sometimes some secretions will be around, and then you can take something and just clean them around. And I'm just pulling, and that maneuver is very important, is really to retract the chin and really to be able to see the neck. And then I will take the other trach tube, which is the step that the person that's right in front of you can actually help with if you're two to doing it. And then I'll take the new tracheostomy tube and insert it in. And as soon as it is in, I remove the obturator to make sure that the trach is widely open and patent. And then you can attach the new trach in and then resuction your child to make sure that everything is okay and that there is no secretion around. This is a trach change that is done in a controlled setting. You might need to do a tracheostomy change in a more emergent situation, in which case you might not have all of these things, but in which case the important thing is that you do have a tracheostomy tube that is the same size and a tracheostomy tube that is one size smaller.